Hello, everyone. Good afternoon, and welcome to the National Center for Civil and Human Rights. Welcome in. Okay, just giving people a couple seconds to get signed in here. And we're going live to Facebook. Okay. All right. Get signed in here. Okay. Looks like we're good there. Sorry for that. Just a little bit of a blip technologically here. Okay, there we are. So, as you can see on the screen here, our program today is called The Struggle for Wellness, Race, Inequality, and COVID-19. Before we begin, I just wanted to take a moment. I'm sure everybody's aware that tomorrow is a pretty important anniversary for our country, and I just wanted to take a minute to address that. Our program today is by no means what I'd call like the time and place to delve deeply into the topic, but one of the things that's been on my mind of late while thinking about 9/11 and all the people in the country who've experienced so much tragedy is the experience of children, young people who were born after 9/11 or were born just before. They've grown up sort of in the shadow of this tragedy, and simultaneously there are all these folks in Iraq and Afghanistan who similarly have grown up as in a way like so deeply affected by this tragedy. And I'm very impressed by how they've been able to move on and move forward in their lives. And I think it's important for us who have such a different experience to be mindful of them and to think about on an anniversary such as this today that there's a lot that we can do that as older people, more experienced people, to share our experience, to continue to help them as they move forward into the future, and hopefully build us into something better and bigger than we were before. So certainly not to compare experiences or value them between people who in America or in other countries, but I'm just saying that like broadly as a generation of people, there's a lot that we can do to build them up and to improve their circumstances and to move them forward in light of this tragedy that began their lives. So I just wanted to kind of give voice to that and to also to, as I've said in several of our other programs, to remind people to take care of themselves, to be mindful of their mental health, to seek out the care that you need so that you can be healthy and successful. Anyway, so our topic today, as I said in the introduction, is sort of a juxtaposition. Excuse me, by the way, my name's David Hopings. I'm the manager of public engagement at the center. This is a nice photograph of me. So our topic today is about healthcare, inequality, and race and COVID. And I did a lot of research getting deeply into racial health inequalities and stuff. And I just found that the data is just that. And I realized that I'm going to be on this panel with these women that have so much experience and knowledge about what's going on in these different corners of this issue. And I thought this is a mistake to sit here and quote people a bunch of facts to discuss health inequality and COVID. I should really just hear from them. So I'm going to go ahead and introduce our panelists, and then we're really going to dive into the topic rather than, giving people a lot of data. So first up, I'd like to introduce Jemea Dorsey. She is the CEO and president for Center for Black Women's Wellness. Welcome, Jemea. Next, I'd like to introduce Diana Berrent. She is the founder of StoryCorps. Welcome, Diana.
Thank you.
And last, but very far from least, I'd like to introduce Jessica Martinez, who is the Director of Development at Latina Association, Atlanta. Welcome to each of you.
Thank you so much for having
us. Thank you.
Yeah, no, thank you. Thank you for taking the time. So, Jemea, I really wanted to kind of start off the conversation with you because it seems to me that your organization is inherently involved in overcoming the inequalities that there are for Black women and Black families in America. So maybe if you could tell me a little bit about what you do, and we could kind of dive into the issue through that a little bit.
Sure, David, and thank you so much for having the center represented on the panel, for having me, and I'm really glad to be a part of this discussion. And thank you for starting us off really with that reflection on the anniversary of 9/11. I am a native New Yorker, so as you, reflected on the 20-year anniversary, even though I had already moved to Atlanta by then, I've been in Atlanta for many, many years. It actually helps to, when I think about the trauma that we're all experiencing now with COVID and thinking about the trauma of 9/11, it's really appropriate to frame the discussion with that. So thank you. So I'm Jemea Dorsey. I'm the CEO of the Center for Black Women's Wellness, and we are a community-based nonprofit organization located in Atlanta. And we've been around for over 30 years, and we're really focused and centering our work around improving the health and well-being of underserved Black women and their families. And we really do that in a few ways. One is really around this notion of ensuring access to equitable health care for those who need it most, those who are uninsured and underserved. We also do a lot of work in the maternal infant health space, where we're making sure women are connected to prenatal care and that we're really addressing the health of a woman before, during, and after pregnancy. And then lastly, doing work around economic health, around financial literacy, and microbusiness training. So that's the work that we do. I'm glad to be here.
Yeah, it's interesting to me when reading through your website, the way that women's health and family health overlap consistently. And I think that's a really sort of important aspect of how we can begin to overcome inequalities, is by seeing this kind of broader way in which we can view them and begin to approach people. So how are families a part of what you guys do?
Well, it's whenever you're dealing with a woman, you are dealing with everything that is within her sphere of influence, and that is of concern to her. And so that's very much her children and those around her. And so, our commitment really is around, if you ensure the health of a woman, you're ensuring the health of her family and community. So while much of our work is in the women's health space, we actually do serve men as well. We have volunteers who do free primary care and chronic disease management to uninsured men. So that's one way in which the family is served. And then in that work around maternal and infant health, we are very focused on the entire family unit, because we know that when we are talking about the health of a woman and the health of her entire family, it is making her make healthier choices, and it's making her basically healthier to have more positive birth experience and birth outcomes. So the whole family unit is very important to us, and we know that we don't operate in silos as Black women or any other woman. That we don't bring one part of ourselves to an organization or to anything. That we're bringing ourselves, our wholeness, and so we're really intentional around this notion of holistic care, comprehensive care. What does it look like to be healthy, not just from a physical standpoint, from the mental and emotional standpoint, but also the economic standpoint? Because and certainly I think that this whole COVID pandemic has taught all of us, or it's highlighted this notion of this intersectionality. And that when we're talking about health equity, we're really talking about how all these factors come into play. Economics, housing, all of these factors that are needed in order for us to be healthy.
Yeah. Jessica, I see you nodding quite a bit. I know, like, having our experience with Latin Association, that a lot of these same ideas are kind of woven into your organization as well.
That's true. So we at the Latin American Association, or the LAA, we are the longest and largest organization serving Latinos in the community and in Georgia. And so what we do is we really meet Latinos where they are. Our mission is to empower Latinos to adapt, integrate, and thrive. So we have people that come through our doors in all stages of life. Some are, just looking for food, to bring food on the table, to finding a job, to, hey, I need to learn how to speak English and I need a job, or my kids are struggling in school, what can I do? And so we serve the families as a whole, because, if the family is doing well, like, Jemea said, if the mother is doing well, then the family is doing well. So we really try to get to folks to a point where they feel stable, and whatever that is, and then help them and continue on a journey, because many clients that come to us come for one department and they stay with us. We get to know them. They're part of the LAA. We get to know their family, and, they're part of us. And so we continue to serve our families all the time. They never go away.
Right.
Yeah.
Was there something you wanted to say a moment ago? You had kind of a furtive face. I wanted to make sure I didn't miss something you had.
Well, I think the point that Jemea said about, if the mother's doing well, the family's doing well. And as we know, Latinos are very family oriented, like many other, ethnicities. And so, the family is the hub, it's the unit. And if one person's not doing well, the whole family struggles. So
Absolutely.
We've seen that impacted a lot in COVID significantly. I mean, the changes are the crisis. It's a crisis for sure in the Latino community.
So, I mean, either one of you, tell me a little bit more about that, on an anecdotal level, what sort of stuff in particular to Atlanta are we seeing as far as how your work is being directly impacted by COVID?
I mean, I can say for us, I mean, with us as a healthcare provider in a city building, I mean, we're in a neighborhood center, and we're very intentional around being in that neighborhood space, in the hub of a neighborhood that's underserved for those who may be intimidated by a traditional doctor's setting. So during COVID, of course, there was a shutdown, so we shut down, and we were able to pivot pretty quickly and begin to offer telehealth services, and really find creative ways in which to connect to our clientele. But just in terms of thinking about the vulnerability, we did a lot of work around COVID relief. So we were able to actually provide some direct support in terms of rental and mortgage assistance, utility assistance, gift cards for grocery stores, which was really work that we had not traditionally done, but we knew we needed to, since we were a trusted resource in the Atlanta community, we wanted to be that safe space and continue to be that safe space for vulnerable women and families. But really kind of what that looked like when we were looking at and surveying those who we were seeing during that COVID relief. I mean, we had 71% of those who we served who worried about stable housing in the next 2 months. That was really compelling to us. Also, 62% reported that electricity, gas, or oil or water was being threatened to be shut off. 57% ate less because they had less money for food. And then 43% needed to seek healthcare, but could not because of cost. And so I think that showed us very early on, we were already dealing with a very vulnerable population that was already teetering. And then the impact of the pandemic, with many women who were gig workers, or they're working, in, retail or restaurants, and hours cut, laid off, that they were, going to fall off the cliff. And so, we were really fortunate to be able to be that soft landing for a lot of families. But I think that again, the pandemic has just highlighted the inequities that have always been there.
Yeah.
And I think it's just important that there be, programs and organizations and opportunities for us all to come together and collaborate to address health equity.
Well, what's kind of interesting about you saying that some of those things is that obviously economics becomes so much a part of health outcomes, and also, access to services. And one of the things that interested me initially about StoryCorps, Diana, was that it kind of grew out of this sort of organic process on Facebook, which is kind of an odd way to really go about developing these kinds of ideas and kind of finding new solutions. So like, is that economic aspect, these new tributaries, kind of a relevant idea for you?
I'm not sure exactly how you mean in terms of how it applies to StoryCorps.
Well, I mean, like, because the medium, I think, is quite a bit different. Like
right, it's accessible to everybody.
Mm-hmm.
Pretty much everybody, most everybody has access to the internet at this point. Mm-hmm. And right now, with long COVID, there are no more answers for the wealthy than for the poor. And everyone is suffering, but we need to provide a support structure under everybody, because right now there is just a dearth of answers. There's not been enough research, and it is, I mean, when I listened to the way you both spoke about the role of women in the family, we've seen that more men die of acute COVID, and that leaves a lot of widows, for one, but also long-term COVID affects more women than it does men. And there is thought that it is actually in part a autoimmune disease, and women are more susceptible to autoimmune diseases. So it would follow that pattern. That's one possible explanation. There is no definitive explanation on anything right now. Mm-hmm. But think about the women who are supporting their families, but in every way, shape, and form, who are the matriarchs of their family. The average long COVID patient is a 45, 46-year-old woman. That is the same person who, like, I was exactly a 46-year-old woman when I got it. But these are the people who are taking care of their parents and their children at the same time. Which I was literally doing at that same time. And so imagine taking away the financial resources, or if I had just been widowed because my husband, God forbid, died of COVID and I didn't have an income source, and I'm now struggling because I've been sick for 15 months and I can't go about my daily life. We need to really wrap our heads around the number of people who are struggling with long COVID. And the fact that we are an open group on Facebook makes it complete, and our website is StoryCorps.com. But I will be honest, our membership looks mostly white to me. And I don't know, I've come up against, I just haven't found answers of how to change that. And we make sure that equity is a part of everything that we do. So for example, the first longitudinal study, the first study that we launched was in July of 2020 with Columbia University and Chan Zuckerberg Initiative. And it was a longitudinal study of people who got COVID in New York, because New York was hit early on, and following them over the course of time, both serologically, so tracking their blood and serum and checking their antibody levels and so on and so forth, but also tracking them symptomatologically. Sorry, I'm not speaking. Tracking their symptoms, let's say that.
Yeah.
And we made sure that the demographic of our cohort matched the demographic of the way New York was hit by COVID, so that we had 5 times as many people in our cohort from the Bronx as from Manhattan, because there were 5 times as many people who were hit by COVID in the Bronx. And But part of our struggle is to make sure that people in every community are afforded the same opportunities to engage in studies, because we will only engage in studies that benefit the patients and don't use them as subjects.
Right.
Where we make sure that we don't engage in any studies that does not create a 360-degree educational feedback loop with the patient, with the, or citizen scientists, let's call them, because we are all patients to a certain extent. And we also need to make sure that when monoclonal antibodies are searched, that they're searched to every neighborhood, and that everybody has the same knowledge, and that of who is eligible for them and who isn't. Because if you get diagnosed with COVID today, that is the best thing that you can do to save your own life.
Right.
And whether it's I don't like to say breakthrough case, but whether it's a post-vaccination case or whether it's you haven't been vaccinated, either way, you want to get your hands on them. And we need to make sure that we're really thinking about how we are communicating that to every neighborhood and every population. We all paid for it with our tax dollars. It's free.
Right. Well, that I was actually kind of come back to that a little bit later, but since we're here already, either one of you, Jessica or Jemea, I'm curious to hear like what you see as, from your own perspective, from your organizations, like how new ideas, new invitations are kind of coming into folks. Do you feel like, what sort of feedback do you have on what Diana said about their struggle to find people of other ethnicities to participate in these kind of studies?
Well, I can tell you for us and at the LA, we've seen for sure just the folks Latinos not wanting to even be tested for COVID, and then don't even mention the vaccine. And a lot of it is misinformation. A lot of it is lack of trust. Unfortunately, there are quite a few Latinos that are undocumented, so that puts fear. So they're afraid if they go get tested or they get a vaccine, there can be implications from that. So, it's kind of a snowball effect. It started with just getting tested for COVID. And then we saw a lot of different things. People either believed it, they were extremely scared of it, or again, they thought that if they went and got tested, there could be implications. So that just kept going on with the vaccine. And there's a lot of misinformation. So we've been trying to really inform our clients, the community, the Latino community, about the importance of getting tested, of getting vaccinated. We actually have done vaccination clinics in our office. We've vaccinated over 7,000 people this year. And it's actually slowed down quite a bit, over the summer.
Really?
And one day, significantly. There were days that we would have 150, 200 people coming in to vaccinate. And then now sometimes it's 5 to 10. And as we, that's pretty typical what we're seeing with just vaccinations in general.
Right.
But we've been trying to really become the hub of communication for COVID education and vaccine information. And we've had great supporters. Kaiser Permanente joined us, and we started a coalition with some others, with UPS and with Walmart, to really put out as much information as we can about the importance of getting the vaccine, dispelling any myths, and then doing it in a language that our clients and the Latinos can understand from people that look like them. So they understand that I can do this, it's fine, there's no cost, there's no implications for me getting a vaccine. And there's a lot of, unfortunately, things that go wrong that people do charge, or, there's a lot of, other factors. We've even had Dr. Toomey come to our office quite a bit, Governor Kemp, and there's really been an initiative to reach Latinos. Because in Gainesville, we have an office, or in Dalton, we have an office in Dalton too. The number of Latinos up there with COVID is astronomical. And a lot of people don't want to get vaccinated. People are not wearing masks. They're not taking precautions. So really trying to give out the information that's really needed so that we can, get to a point that we can move past this.
Can you speak a little bit to the misinformation that you're referring to? Like sort of what sort of sources that's coming from? I'm just curious, like, for me.
So, it can just be word of mouth. Latinos, we do like to talk a lot. We rely very heavily on the opinions of our families, our friends. So-and-so said that their brothers, sisters, I don't know what, got COVID. There's a lot there. But the misinformation is one from, families, like the distrust and just healthcare in general. Just in general, prior to COVID, many Latinos and I'm talking kind of the lower income, do not seek healthcare. There's a lot of pre-existing conditions, diabetes, high cholesterol, cardiac conditions. And it's, there's a lot of those factors of, not being insured or not having access to healthcare, or again, undocumented. So there's that misinformation again. There's some that unfortunately people are taking advantage of the situation and charging for the vaccine. Or they think, a lot of Latinos think, if I go get the vaccine, I'm going to have to show my driver's license. I'm going to have to show a social security number, all those things. And that's just the misinformation is they don't know that you don't need all those things. You can still get vaccinated.
Right.
We just want people to get vaccinated and that it's free.
Got it. Diane, were you trying to say something a second ago? What was that?
I was just going to mention that our website is in Spanish as well. So it might be something that you can add to the resources that you're giving out to people in terms of getting just more information is more information. And another place to look up, we have listed, what is the difference between different antibody tests? What is an antigen test versus a PCR? A lot of frequently asked questions, webinars, all kinds of information up on there. So, and it's in Spanish as well. So we would love it if you could. It can only help more people, especially people who have not recovered from COVID, find a space where they can. We also list all the post-COVID care centers throughout the country, and so on. So
we would love.
Well, I can say I've never heard of your organization, so I'm so glad to actually hear what you do in that resource, and so I am more than happy. We would love to have that resource. We're in the midst of revamping our website now. We're going to be having a lot more COVID resources on there. So I think this whole notion of support for long haulers is phenomenal. And I'm so glad to know about it, because as Jessica said, on our end too, we've been focused more on just trying to work on educating our community about, the importance of testing, the vaccine, and we'll be doing more of that. We're in the process now of hiring some staff that can be dedicated to doing just that, just because of the long-term nature of the pandemic. So, but I, very, very interested. So thank you for your work.
Before you say that, I just have to apologize. In order to kind of make the statement I made at the beginning, I had to kind of skip over some of the biographical stuff I would normally do in our program, and I kind of wanted to jump back because and go over Survivor Corps and kind of like how it started. If you could kind of give us that, because I think we're deep enough into it at this part of the conversation. I'd like everybody to feel like they know what we're talking about. So Diane, if you could take it away and explain to us a little bit.
Sure, I'll give you the quick explanation. We did not actually start off as a patient advocacy group. I was one of the first people to get a positive diagnosis of COVID back in early March of 2020, and among the first to go public with my story. I had a very average case of COVID. I was not hospitalized. I had what I call the Tylenol and Gatorade, where that's all you get. Tylenol, Gatorade, thoughts and prayers, which, by the way, is still the same standard of care, unless you qualify for monoclonal antibodies, which I would not. But it doesn't take much to qualify for them now, so do pursue it if you get COVID. But I went public with my story because it was maddening how difficult it was to get tested, and I was afraid that I was patient zero for my town. Right outside of New York City. And I did test positive. I ended up with a daily column and video blog with the New York Post for about 2 weeks. I was, during that time, I became obsessed with convalescent plasma. And the idea that if I was going to be one of the first survivors, there were going to be many to follow. I had obviously no idea how many, but we would walk out of this with life-saving powers, that we could literally donate our plasma and save lives, which was just amazing given the fact that I walked out of my isolation with some presumed degree of immunity at the time. That didn't totally pan out, but that I had the power of the doctor, and I hadn't taken a science class since high school, but I could go out and, actually save lives. And also I could support science by donating my experiences, my blood, my plasma, whatever it is that they wanted. So I ended up actually receiving the first antibody test in America on March 28th at Columbia University. I was one of the first plasma donors, and I started SurvivorCorps on March 24th, 2020, while I was still in isolation, with the mission of mobilizing an army of survivors to donate plasma, which no longer is happening, but that's another story, and to support science by participating in every trial and study for which you qualify. And within a few weeks, we found out that many of, we had probably 10,000 members in the first week. It remains a Facebook group of about 180,000 members now. And you do not have to have had COVID to join. We have a lot of smart doctors are there because there's more real world evidence in that group. And so not only has it become a patient advocacy movement and a space where people are really able to help each other, but we have also really changed what it means to be a citizen scientist. And we have really, because we have access to probably the greatest data set on, not probably, we have the greatest data set on non-hospitalized patients in the world. Because what was happening was, who are you going to study? You study the people in the hospitals, because we didn't have anybody going to their general practitioner with COVID. We were using our emergency room as our first line of medical defense. So only the experiences of about 10% of people were being studied, and they had a very different disease trajectory. We started to find that people were not getting better. And, the true numbers that the statisticians say it's probably we're at around 135 million actual infections in the United States. And this was as of a few weeks ago before school started.
Right.
So who knows what we're at now. Take a third of that, and that's probably on the conservative side, given recent studies that came out of China and Italy. And you have, can you imagine if, let's say, 45 million people developed a new form of cancer in 18 months? We would be throwing money at it left, right, and center.
Right.
But we're not. We have money stuck in the government, and there's not enough research, and SurvivorCorps is there to push that research forward and make sure that we get as much help to as many people as possible, and all based on principles of equity, transparency, and collaboration.
Could you define that concept, citizen science, for me as you describe it? Because I'm wondering if, if I'm thinking of it the same way that you are, and for purposes of conversation,
So traditionally, a citizen scientist would, you need an expert, find a patient. But it was a limited role and not one that was taken particularly seriously. And we have elevated it. I call it citizen science 2.0. Citizen scientist collaboration. So an example of that is, I have a couple, but here's one. Dr. Akiko Iwasaki at Yale, who is Viruses Immunity on Twitter. She's the Chrissy Teigen of science, basically. And she is known as being the greatest virologist in the world. And she floated a couple of theories on what might be the biological mechanism behind long COVID. Was it viral persistence? Were there pockets of virus hiding out in the body somewhere? Or was it this unregulated autoimmune response, or some combination thereof? And then another doctor piped up and said he started to see patients who felt better after the vaccine. We went and did a poll and found of a couple of 2,000 of our members, 55% of them were, no, I'm sorry, I think that was it. I'd have to go back and look at the numbers exactly. Were feeling better to some degree after the vaccine. We don't know if that was, it wasn't a longitudinal study, so we don't know if it
Right.
was, if that relief remained, but nobody had reported anything that had made
Mhm.
them feel better yet. I will say that 14-15% felt worse, so that needs to be stated as well. But we were able to get that data within a couple of days, and we got it to Dr. Iwasaki, and we started a joint Yale survivor core study
Mhm.
where people were she looked at people's autoantibodies before and after getting the vaccine, people who had long COVID. And we developed the cohort for her
Mhm.
because we had access to people. And so she floated the idea in February. We started talking in March. We were registering people, I believe, by the end of April.
Mhm.
And most of the study has been finished, and we will get results very soon written. And
Yes.
just that is pardon the expression, but that is warp speed.
Right.
I dare you to find a scientific study that has happened in that record time.
Right.
And so that is what happens when citizens and scientists work together in collaboration.
Mhm.
We can make things go much, much faster, and we can also make sure that the scientists are studying the right things.
Right.
Because
Well,
if
what's
left to their own devices, they'll study the most reported symptoms,
right.
fatigue, not the ones that are causing people to commit suicide, not the ones that are causing the most human grief and suffering, not the ones that are keeping people from going back to work.
Well, what's interesting to me about that is that what you're describing mimics a lot of organizing history as far as, meeting social goals or meeting healthcare goals or all different community goals. So I mean, Jessica, I wonder if it connects with you with what Latin Association does on a whole lot of different levels. Like, I wonder if this is something that would be interesting, like with youth or with students. Like, it's kind of it seems like there's a lot of opportunity to open this kind of idea to more people.
Absolutely, I agree. And, I was going to piggyback off of Jemea earlier that, I hadn't heard of StoryCorps either.
Uh-huh.
And I definitely think, we are, again, trying to become, or, the hub for COVID information, for
Mhm.
Latinos, especially in Georgia. And thanks to, or thanks or no thanks to the pandemic, we've been able to expand. We have a lot of people that now tune into
Right.
us from all over the country. And
Right.
they take part in some of our virtual programming because now they can, because they're, they can do it virtually.
Right.
So I think there's definitely some overlap there, especially for groups that are more underrepresented, Latinos, the African Americans, before, and I don't even know now because I haven't even looked, but before when they were doing testing, we didn't know how many Latinos had COVID because they weren't asking that. And I
Mhm.
think it was very similar to African Americans. So I think there's a lot of pieces in there that there could be some overlap and definitely an opportunity to work together. And I'm sure there'd be plenty of folks. I mean, I had COVID and I would definitely participate in something like that.
Mhm.
Because the more the more we can find out and get past us at some point.
Right. Right.
Exactly.
Jemea, does
I
that
would
resonate?
also, can I also mention one
Yeah, yeah,
thing
sure.
about the vaccines? I have found that the best way to convince somebody to get a vaccine is not telling them that they're going to die or end up on a ventilator. No 25-year-old thinks that they're going to die. They're all invincible. They're all immortal. Tell them that they run a good chance of ending up with erectile dysfunction. Their teeth and their hair will fall out, and they'll go get it the next day. I mean, that day probably.
Well, I already did, but I see your point.
Yeah, well, but it works every time. And
Yeah.
I'm always asked, what do you tell people to convince them to, go get the vaccine and
Right.
stay safe and still mask and all of
Right.
that stuff? I'm like, spend 15 minutes on Survivor Corps. I
Yeah.
will tell you, they will be running to go get their vaccine. Because it's just psychologically, it's hard to imagine like, okay, there's a tragedy that it's going to affect you.
Yeah.
But the smaller things they're real.
Yeah.
And they are, and you don't know, even if you've had COVID and you think you're fine and you had a mild case,
Yeah.
might not have been so mild, My son had a mild case. He was 12. He lost one of his adult front teeth with no blood loss, unprompted, 9 months later. So we don't know who's actually in the clear yet.
Yeah, yeah. Jemea, I wonder, like, that Diana's idea about how to communicate the need for vaccines, I guess, is a bit extreme. But I also think
I love it. I think that's real.
Works.
That's right. Yeah.
But it also connects to what you were saying before.
What's the response for women? I was like, okay, give me the erectile dysfunction.
Oh, your teeth will fall out and you'll lose your hair.
That's a good one.
Your hair will fall out and your teeth will fall out. Because also dental care is, the dental divide in this country is huge.
Gosh,
that goes beyond racial demographics. That is, it is, dental issues bankrupt people. So it's not just their Freudian nightmare. It's not just their, primal nightmare, because if you lost your teeth in nature, you would die, you'd starve to death. But it is your literal financial nightmare, because we live in a society that thinks it's okay to have different insurance policies for different organs, which is insane. The mouth is far more important to your health than your elbow, and we have two totally different policies for them.
Right. I was kind of curious. One of the things I thought we might talk about earlier, but I wanted to jump back to is
you can never go to the gym again. That's another good one.
Ooh.
That wouldn't resonate with our but the hair falling out and the dental would. And interesting, what I was thinking is that we do work with a lot of pregnant and postpartum women, and there are genuine concerns around vaccines and pregnancy. Also, we found among those that we serve, older women and men were all on board when the vaccine first came out. So we really didn't have, being our healthcare provider, if they were coming in to get, healthcare, she was driving home the point and they were going to vaccination centers and getting vaccinated. And so it's been, just like across the nation, younger individuals, it's harder to we don't even
tell a 17, 18-year-old boy that he can never play basketball again.
Right. So these are we'll definitely do some more talking with messaging, because we definitely need the messaging. It's helpful. And then we probably, what we're hearing a lot is women who generally have concerns around fertility. There's a lot going, that's what we hear. We say that recently, our clinician says she's, always driving home the point and say, well, I've done my own research, and, I've made up my mind, I've made my decision. And so we're very, we're sensitive to that as well, because we think it's important. People, and Black women are entitled to have questions. And we want to be that space where you ask questions. We are not in the business of, shaming and blaming. Women have been shamed and blamed enough. We're not going there. And just from a whole reproductive justice framework, it's important for voices to be heard, and for women to have a voice, and that voice to be articulated and heard. And so it's all about, providing information, and again, in a way that is not about shame and blame. That's very important for us. And to hear the genuine concerns, and to be able to have information and responses that also, again, it's just like with anything else. Again, in the maternal health space, it's around, what do you want? What is your plan for yourself and your baby? Not what we want for you. And so I think that that's very important in any kind of model and approach that we're talking with, because we cannot assume that we're the experts, we're the know-it-alls, and that, so that's, but I think this is great. And I'm very interested, again, in resources that are available for those who are long hauls, because oftentimes, to be very, very honest, Black women suffer in silence. And this is across all health domains. Yes. So we don't, and so one of the things that's been a little very heartening is that during the pandemic, there has been an increase in seeking mental health services. So as an example, we partner with an organization who was doing individual therapy during once a week when we had our physical health care. People were coming for primary care and individual therapy was available. That got converted to telehealth very early on. And that, just has grown astronomically, so now we're doing individual and group. So because there has been more of a heightened need for women who are truly suffering. I felt what you said, Diane, as you just talked about those who are, and we certainly as a community, we have had so many impacted by COVID. We've had, even among our staff, so many who've lost family members, parents to COVID. It is hard. And even and still there is a suffering in silence. And so that is what's really drawing me to what you're saying, and I'm connecting with that because I think it's important for that to not be the case.
That's so powerful what you're saying, and I think that one of the challenges with long-term COVID is explaining to people, doctors included, that this is a thing, that this is a real thing, that this is, especially because it affects more women than men, it can be seen as almost a modern diagnosis of female hysteria. And yes, people, every time I go on TV, every time I'm on the radio, I am bombarded with emails of, oh my God, I thought I was crazy.
Wow.
There's nothing crazy about this. This is a disease that affects at least 1/3 of people who have had COVID. And again, predominantly women. And so part of it is education and letting people know that if you're not feeling well, if you're not feeling back to yourself after about 8 weeks, you need, something's going on and you might really need medical help. And this is where you can find it. And this is why you're feeling this way. And there are, so many others, because there's just a tremendous amount of gaslighting going on.
And just for you to say 1/3 of people who,
that's huge. And especially if, let's say, you and your husband get COVID. My husband, I gave it to him.
Yeah.
He was fine in 72 hours.
Yeah.
That was it. Yeah. Totally fine.
Yeah.
And I was sick for almost a year.
Right.
And, and so imagine if you were saying to me that whole time, I don't know what's wrong with you. I got over it.
Right.
Why are you still complaining? You still can't exercise. You still can't do this. You still can't do that.
Right.
We're talking about college athletes who are now in wheelchairs. Okay.
Yeah.
33-year-olds who are on, permanent feeding tubes. We're not talking about a little bit of, fatigue.
Jessica, I wondered, you were talking a bit about experience of COVID with clients and participants at Latina Association. I wonder if you've been hearing much about people who are having long-term symptoms or are really not getting better, as Diana was saying.
So I've heard a little bit about it, from my colleagues. So I work on the money side. I'm the fundraiser. I'm the one that makes sure that we're able to get the money in the door so we can continue to provide the services and programs that we do.
Right.
I've heard some. What I hear more about are just the loss of lives, the what we were talking about, the widows, the families that are left without either the female person, because it's not always a mother. It could be a grandmother, an aunt, or whoever, or the male figure. I've heard a lot more of that than the long haulers. I think similar to what Jemea was saying, the suffering in silence, a lot of Latinos tend to do that as well. They kind of feel, they might not feel 100%, but they continue on with their day. They go to work if they have to. They continue taking care of the kids because that's what you have to do. You have to bring money to put food on the table and have a roof over your heads. So maybe those long hauler symptoms or what have you, they're just being ignored because there's no other choice, because if they don't work, they're going to be on the street. So I think it's more of that. than what I've heard on, you know, the long illnesses and everything like that.
Yeah, which I mean really comes back to what we were addressing before about how in a lot of the science and a lot of the research, it is the loudest voice in the room that gets a lot of the attention. And so I think like that to me was why I asked, because I wanted to really hear from both of you that idea that like there's a lot of the suffering in silence going on, and it's not because there isn't suffering, it's because it's in silence. That, and I think that that's just a really important aspect of the conversation. Did you oh, you know, I forgot there was a question here. Someone was asking about is LAA encouraging workers to get vaccinated? So I guess like maybe in a more work setting was their point, or like away from, I guess,
Absolutely.
with employers maybe.
Absolutely. So we've definitely, you know, part of our coalition, we've been trying to, again, get the information out there. And we, you know, in our office in Dalton, we've partnered with, I believe it was with Mohawk. We did some vaccination days. You know, we worked with Shaw, which are the carpet industries, you know, the largest in the country. They're in Georgia. You know, they're huge, very large populations of Latinos. Also in the poultry industry, that's another area where there's very heavily focused on Latinos. We've been trying to get to them and doing vaccination drives and working with community partners. I think what the great thing that COVID has done, not to say that we didn't have it previously, because we did, you know, partnerships and whatnot, but it's really brought the community together to have a lot of organizations to come together for the common good, and just making sure that we get to a point that everyone is getting better, everyone's safe, and just getting the things that they need. So we've been doing a lot of collaborations with folks to get vaccination drives, getting the information out there. We've been on TV, we've been on radio. You know, there's some Spanish radio stations that are very heavily tuned in by Latinos. We continue to do things with them, as well as Telemundo, Univision, which are the Spanish radio stations. Going to, there's a place on Beaver Highway called Plaza Fiesta, which is huge. You go on a Saturday, prior to COVID, was always packed. I mean, it still might be packed. But, you know, trying to do vaccination drives with them, and just a lot of folks coming together to make sure we can vaccinate.
It's just so interesting. I mean, because all of this conversation, there's been a million points about how COVID is creating more connections than there would have been otherwise, new work that there wouldn't have been otherwise. I just wonder kind of like what this can grow into, you know, like what sort of aspiration should we have, because this is, you know, a moment of tragedy and a moment of opportunity. I don't know. Oh, feel free. Yeah, go ahead.
I can tell you, even just at the LAA, the way that we do work now has changed. Before, it was very client facing, very face to face, in person. You would go to our office, our lobby was packed with folks. Now we've been able to transition to such a virtual nature, and we're going to continue, even, you know, as COVID gets better and maybe we move away from having to do so many Zooms, more in person. We're going to continue a lot of the program that we have, because we've been able to help so many folks. So I think a lot of communities have seen that too, and a lot of our partners have, that there's a new way to work. And one of the things that we saw too at the beginning of the pandemic is a lot of our clients were very vulnerable. We did not know the extent. We figure everyone has a cell phone, everyone has a computer or an iPad. That was not the case. We had a lot of clients that didn't even have a cell phone. They would call us because they would borrow somebody's phone or something like that. So we had donors that gave us cell phones. We were able to give, you know, with contracts, I think it's a year or two for each client. So, you know, we're able to see that there really are a lot of people that are still way behind. However, with that, we've been able to teach, and we've been able to show clients that, you know, you can use a phone. We can communicate with them through WhatsApp, through Facebook Messenger, through texting, phone calls. It's not just, you know, the general Zoom. A lot of people didn't know how to use it. But we've come to a new, I guess, technology space that will continue on. And I think it's a great way to expand a lot of services that we were doing. And I'm sure a lot of organizations are seeing the same thing.
We're doing the same thing. I mean, it's interesting. I think it really becomes like not a either or, but a both and, right? I mean, like, obviously we've had to do everything a lot more virtual. And that does open up opportunities for way beyond, you know, our immediate area, in terms of virtual health education, some of the virtual individual therapy, group therapy, all that work that's happening, even virtual home visitation with our pregnant and postpartum moms. But then there's also, as important as that is, as impactful as that is, I think there's still the human connection element, that at the end of the day, especially with direct service organizations, there is that need for human connection. And there are those times when it's really very important to have those face-to-face interactions. I mean, obviously, case in point, providing healthcare. There's certain things you can do via telemedicine. You can't do a pap test or a clinical breast exam via Zoom, right? So it's like and so many have gone without preventive healthcare because of the pandemic. And so that has been a real barrier, for folks who have gone without healthcare for a while, gone without basic screenings like screening mammograms and all other kind of cancer screenings. And so we want to be sure that, that they're, that folks go and get those services because it's so important. And so, for long-term health outcomes. And just a lot of other things happen at a doctor's office. I mean, where there's depression screenings or other types of things and certainly a lot of those kind of social determinants of health screenings. And so really being able to know what is going on and how we can support folks.
Got it. Well, okay, Diana, so we've got you thousands of new Black and Latin citizen scientists. So, Madam Founder, so where are we going here with Survivor Corps? What?
Oh, no, I think that's great. I mean, I one of the things I talk about is like we need to come out of this crisis stronger, right, with a more equitable system. And one of the things that hurt us the most during the pandemic was distrust in science. And I have to say the government did not help things any in how they have been messaging and or lack thereof. But we need to rebuild trust in the scientific process. And one of the best ways of doing that is including people. Mm-hmm. And that's sort of a short game and a long game at the same time. But if you are part of the process, mm-hmm, you understand it, and and anybody can be. I mean, that's the beauty of it. You don't need to have any level of education. Again, I have not taken a science class since high school. I've never taken a public health class. Mm-hmm. But I get to work with the top scientists and doctors in America, and we just have to continuously make sure that we are learning our lessons of how we can do better. And when things aren't working, change the channel. Like the vaccine message has gotten through to everybody who it's going to get through to. Now we need to come up with a different message.
Right.
And we just, it's like dealing with a child. If you're not getting through to them after a certain point, you change the channel and try a different method. And I think that we can all do better by working in closer coordination. So I'm thrilled to have met you all, and I am thrilled to work with you all going forward. We have studies coming up that we are registering people for. It is, and it's also a way of people getting amazing health services, right, that aren't afforded to anybody, no matter what they can pay.
Right.
So you think about it that way too. It's a tremendous benefit.
Well, are there any upcoming events, links, piece of information from each of you that you'd like to let us know about? Jessica, anything that we should be looking out from LAA?
So we'll still continue to do vaccination drives. We'll be actually doing a food distribution drive tomorrow in our office. So actually last year we served over 10,000 families with food distribution, and we opened up a food pantry this year. So
congratulations.
Thank you. Yeah, thanks to funding too. We had some great supporters behind us this year. Those are big things. We have, of course, our well, you know, just COVID. We have our gala that it's supposed to be next month, and we had to go virtual, or not even
Yeah.
virtual. We pivoted to just fund a mission, you know, and I
Yeah.
think it's just affected everything. But definitely folks can check out our website for information about COVID in Spanish. We do have a COVID page. So Diana, maybe we can connect after this. And
Yeah, that'd be great. We can link to one another. We can link to one another. That'd be terrific.
Wonderful. And then, you know, just keep a lookout, folks that want to get vaccinated, that need any information in Spanish, any folks that are, you know, translations or anything, let us know, because we want to make sure that we can get to everyone and get folks vaccinated.
Fantastic. Well, Diana, you're already speaking. So anything you'd like us to take away?
I will say that we actually just signed up to help a study yesterday that we'll be announcing next week, but I can just tell you what it is. It's actually really cool. And they're not looking for a ton of people. So if you had damage to your lungs from COVID, whether or not you were hospitalized, whether or not you were on a vent, if you are at under, I believe, 70% lung capacity at this point, which is not hard to get to, unfortunately, even from a mild case of COVID, we have an opportunity to engage in a 12-month study where you will get this, you know, or you'll be in the control group. I don't know how they're working it, but they're looking for volunteers, and you will get the probably only treatment that's out there to actually reverse pulmonary damage. And so we're going to start enrolling in that immediately. But if you are interested, just send an email to hq@survivorcorps.com, and we'll put your name aside for the moment we start signing people up next week.
Awesome. And Jemea, please, the same.
Yeah, for us, we are, as I mentioned before, give us around 30 days. We're revamping our website, but you can still check it out at cbww.org. We're going to be, we are now, but we will do more of posting all of our events and activities. Of course, we are a provider of healthcare, women's health, primary care, mental health services, primarily focused on those who are uninsured or underinsured. Big screening mammogram program. So if you are in need of those preventive healthcare services that you have gone without for a while because of lack of insurance, you know, we are available and happy to see you. We do a lot of virtual health education. The best, like, real-time way to find out what we're doing is through social media, Facebook and Instagram, CBWW Atlanta. So again, we are just really, as tragic as this pandemic is, we are grateful to work with, you know, amazing partners to be a part of the solution. So again, whatever this new normal looks like, we've got to create something different that is certainly more equitable and respectful for all.
Absolutely. And just from my end, you know, it's a chaotic time for everybody. It can be a very tragic time for many of us, and it's often said, but I mean very deeply, thank you so much for taking the time with us today. This program will live on our YouTube and Facebook for at least a few months, and we tend to see a lot of people check out that way. So if you're seeing us in the future, thank you for visiting. Check out the websites for LAA, CBWW, and Survivor Corps. Thank you so much. And have a wonderful Friday afternoon. Thank you so much, ladies.
Thank you.
Bye.
Thank you. All right. Well, thank you. Thank you, David.
I thought he was going to say something after.
I know. Yeah. Okay. Curious to know how many tuned in.
Absolutely.
Yeah. Okay. Well, nice to meet you.
You.
Yeah. All right. Take care.
Bye-bye.